Yeah, welcome back to the show. This is the AM show. I am Gifty Andopi. I'm doing this with Roland Walker. Let's get on and talk about the AM talk. I'm interested also to hear from you whether or not you want to go out, whether or not you want to go to church. So we're going to just have an analysis of President Akufo-Addo's address yesterday. And my guest for today for that, Dr. Augustina. Dr. Augustina will be joining us via Zoom. Dr. Augustina Silverkin, she is a virologist with KCCR. Doc, it's good to have you. Good morning. Okay, it was good that I said good morning because now I know that we have to work on your sound. We can't hear you. I also have Professor Alfred Yosin. Okay, Dr. Silverkin, let's try again, see if I can hear you now. Good morning.
Good morning, Gifty, and a warm good morning to your cherished listeners and viewers.
Thank you very much. Amazing. We got you finally. Professor Yosin is head of department with the community health of the University of Ghana Medical School. He'll be joining us as well. We'll also be joined by Most Reverend Dr. Paul Kwabena-Boafo, who's chairman, Christian Council of Ghana. And right here in the studio, I have with me Sheik Shaibu, spokesperson for the National Chief Imam. Sheik, you're welcome.
Thank you.
Okay, so once again, another good morning to you. I'd like to start with you, Sheik, to find out, first of all, what do you make of the easing of restrictions that President Akufo-Addo has instituted?
Thank you very much for the opportunity. If you listen to me speaking on behalf of the Chief Imam last Sunday when we did the virtual celebration of the Eid, we had anticipated, whether in the remote future or immediately, we had anticipated that there could be some easing of this, and so we were even requesting for a program of disinfecting, all Muslim worship centers and schools and other things. So it didn't come to us as a surprise, and hints had been dropped also that there could be. But what form the easing was going to take is something that we were most concerned about, because I had mentioned somewhere that the partial easing will have a certain problem for us, which we have seen, because it's the first stage in the easing, so therefore it's partial. So we had indicated that if it's partial, we might be having some difficulties. If it's complete lifting, then much easier for us. Then the onus will just be on us to really put in place the preventive measures and make sure that we observe those.
Okay.
So I think that President's own assessment, based on consultations with health experts, probably, but we had indicated when we met the Council of State, seeking our views, that said we must tread cautiously and assess the risk involved very well. If in the thinking of the President and those who advise him, the risk is so less for us to go easing, then we have no problem. So here we are.
All right, we'll get into the form and talk about the implementation and all of that. But I noticed that your mask is going down. So you see this happens quite a bit. So when you talk, sometimes when you talk, the mask has a tendency of going down. So I'm going to give Sheik a little bit of a break. Dr. Silverkin, I'll come to you. But we want to hear the President refresh our memory of what he said yesterday. Listen.
Fellow Ghanaians, with effect from Friday, 5th June, we will begin stage 1 of the process of easing restrictions. An abridged format for religious services can commence. 25% attendance, with a maximum number of 100 congregants, can worship at a time in church or at the mosque, with a mandatory 1 meter rule of social distancing between congregants. In addition to the mandatory wearing of masks for all persons at all times in churches and mosques, a register of names and contact details of all worshippers and hand-washing facilities and sanitizers must be provided, with a maximum duration of 1 hour for each service. Religious institutions that are desirous of opening their premises to their members, such as churches, mosques, and others, must disinfect, fumigate, and put in place the requisite logistics needed to guarantee safe opening and operationing. They must work with the designated regulatory bodies and undertake test runs of the protocols I have outlined. I would appeal to them, in the case of Christians, on the first Sunday of reopening, i.e. 7th June. In the case of the Adventists, Saturday, 6th June. And in the case of Muslims, on the first Friday, i.e. Salat al-Jum'ah, on 5th June, to dedicate their worship to prayers for the nation in these challenging times. The Minister for Religious Affairs will tomorrow, Monday, 1st June, outline in detail the specific guidelines for the safe reopening of our churches and mosques.
As President Akufo-Addo last night there with the state, with an address to the state about easing of the restrictions. Let me come to you, Dr. Silva-Cain. You heard the president yesterday. Before he even made these announcements, he talked about he gave us an update on the case count. As far as the president's address yesterday, 8,070 cases so far. 8,070 cases so far. And out of that, 36 people have died. Was the easing of restrictions, as the president announced yesterday, what people like you, virologists, expected?
Gifty, of course, I mean, throughout the week preceding to this announcement, there were a lot of speculations. I don't know whether prophecies, so I think these things were expected, and I'm happy the president actually indicated that this is just a stage one of processes leading to the opening up of the restrictions, and he used certain words, and these words really caught my attention, that we need to be strategic, we must ensure our safety, and these things need to be done gradually. So that if we even look at the things he outlined, i.e. the number of congregants at a specific time, only 1 hour, the wearing of masks, which has to be adhered stringently, registration of names, the prior disinfection and fumigation, and of course, church leaders making sure that all the necessary logistics have been put in place. I think these measures are excellent, but I guess it also behoves on all the church leaders to ensure that these measures have been put in place. The good thing for us is that, and this I think we keep on saying, that some way, somehow, we have become an icon in terms of Ghana. Everybody is looking up to us. And I'm sure we are even also learning from the experiences of other countries such as Germany. But of course, we also need to realize that this issue doesn't, it is not a one jacket fits all. We don't have to take that approach. And I'm happy that we are treading cautiously, because even when it comes to easing up of these, the restrictions on public gatherings, some of them will be released. Others, we still have to make sure that, especially things like footballs and nightclubs and things like that, they are still under some levels of restrictions. So in terms of the numbers we are seeing, I mean, we've done so very well. We've done more than 220. I'm sure by today we would definitely have reached, or we will reach 220,000 tests, out of which 8,070. This, so in terms of proportion, this is a little over 3.7%. So I guess the president made these announcements, hopefully based on science, hopefully based on data, and of course also hopefully based on advice from his advisors. But I am looking really forward to the Minister for Religious Affairs coming out to outline specifically. Because, for example, if you are saying that the time for worship should be 1 hour, I don't know whether the registration of names of all congregants will be part of this 1 hour. And then in between the 1 hour, the fumigation, the disinfection, of course, not fumigation, but disinfection. How long must we, in between, how long should we expect, or in terms of duration, how long must we wait for one service to close and then another service to also begin? So I think these are the nitty-gritties we all are looking very much forward for the religious, the Minister for Religious Affairs to come out with.
And it's interesting that you mentioned that, because we also have been joined by Most Reverend Dr. Paul Kwabena Boafo, who is chairman of the Christian Council of Ghana. We'll get his perspective, but I wanted to find out from you, Dr. Silverkin, 1 hour, the 1 hour given or allocated. Right, Doc, thank you very much for your time. Dr. Silverkin, back to you. The 1 hour space given by the president within which religious gatherings should be held. From a virologist perspective and looking at the character of viruses and the way that they work, it doesn't make gatherings any safer?
Like I said, we need to be treading cautiously, because after one service, then it becomes very important for us to disinfect items. And even within the church service, we need to make sure that we have implemented certain things to prevent the spread of the virus. Okay. Because look, as for this virus, all it needs is for human beings to gather. And if one person has the virus, then chances are that once we have gathered and we have, for example, decided to hug ourselves, hopefully, I hope, and I'm really thinking that there won't be any hugging, there won't be any shaking of hands. For example, when it comes to common items we use during church service, i.e. communion bowls and offering bowls, some of these things, I doubt if it will be practical for them to be disinfected, but maybe we may want to use central ones or common ones placed in front of the congregation so that everybody gets up and walk. And whilst we are walking, we need to ensure that we are maintaining that physical distancing space. So I am really looking very much forward to how we'll be able to implement some of these things. I don't know whether our men of God will still be doing the laying of hands on people. I'm sure the most reverend is already laughing. I'm sure these things should gradually be things of the past. I don't know. In fact, when it comes to the registration of names, we know that this virus is such that it can stay on surfaces for a very long time. Things as simple as pens. Are we going to use one pen for everybody to use in writing? I'm sure that even though the president has outlined certain measures, and hopefully the Minister for Religious Affairs will also come out and outline more, give out more details. I'm sure the individual churches would also need to bring on board experts so they help them come out with some very, very simple and practical ways of ensuring that at least we are also meeting together to worship our God. And of course, once we meet, the president said it, we've got to be in nose mask. And I hope and pray that even our church leaders will adhere and make sure that the congregants, because this time it has to be leadership by example. So that if my leader is not in nose mask, then of course, the congregants will also not be in nose mask. And I hope that, as for some churches, they will definitely adhere to these measures. But for other churches, I don't know how they will be able to do that. I hope and pray that one man of God will not just stand up and say that, look, the Holy Spirit is telling me that even the nose mask you are wearing, it is not from God. So everybody remove your nose mask, and then I'm sure that there will be chaos within such church buildings. So
we'll see how that goes.
Looking very much forward.
Let me bring in Reverend Dr. Paul Kwabena Boafo, chairman of the Christian Council of Ghana. Doc, thank you for your time this morning. And
thank you too.
Right. And the question that I want to ask you, Doc, is whether or not the church or religious organizations put pressure on President Akufo-Addo to do this at this time, despite the soaring figures in the case count we're seeing?
Thank you. Good morning, and good morning to your viewers, and good morning to the virologists. I thank you for your words. We did not put any pressure on the government. In fact, I came out several times to make that point very clear, that we're leaving the easing or the lifting of the restrictions to the government and the scientists. And so all the heads of churches we met, and it was very clear before we presented our guidelines for reopening that we are not putting any pressure on the government. The government should come at his own pace, and that is what happened.
Right now, we're looking at 25% of congregations having to meet, at least. Yeah. So we shouldn't have beyond 100 people. What do you make of that?
We think that it's a good start, because the president said we are having it in phases, and so for 100, though in some of the congregations 25% will be more than that, and those who have more spaces, 25% and 100 maximum will be a small figure. But I think we can start with that, observing the social distancing and making sure that all the protocols are also observed. And then if we are looking at how now we want to come in with the registration, writing of names, and then sanitizing and all that, I think that the 100 will be a manageable number for the start.
Dr. Sovakin was, raising some concerns.
Yeah.
We believe, for those of us who are Christians, we believe, we have faith, we trust that the men of God who lead us are speaking the mind of God. She's raised a very key concern about how we tend to follow in what our leaders say in church. So when someone says, well, the Spirit is telling me that we should not wear masks today, the Spirit is telling me that we should pray and sit together. What is the council doing about some of these potential occurrences? Are there any sanctions? Will there be any sanctions for people who go against it? Is there a plan to make sure that we don't see some of these things coming up?
Right. Thank you very much. But if you look at our document, we have mask wearing as part of it. We have social distancing as part of it. So we believe in the scientific addressing of this pandemic as a church. We are not in any way against all the protocols, the hand washing. It's even what God wants us to do. Even as we come to him, we should be clean, we should wash our hands, and then observe all these things. So I don't think that the Holy Spirit, if indeed we are operating within the power of the Holy Spirit, he is a God of order, a God who obeys, a God who wants life for the members. And so if we are talking about life, we are not looking at a situation where you are going to throw away all these protocols, and then at the end of the day, people are infected and then they go to die in their homes, or they don't come back to the church again. That will be a very wrong thing to do. When it comes to the sanctions, we as the Christian bodies don't have that mandate to be arresting, but we'll be appealing to our members to observe the protocols that we ourselves put together and sent to the government. We will have to follow. Those who will not follow, but will want to do things contrary to what we have put forward and what has been given to us as way of preventing, then the law will deal with them. That one, we have said it several times that, see, some of the things that some men of God infringe upon are against human rights, and the laws are there for all of us. They should be arrested. We should not fear that when we do these things, God will be against us. God wants order. And that order is that this is the way we should go. When the churches were closed, when the chapels were closed, that was God's way of bringing about sanity. And we are here talking about life. If life is at the center, then everything that we can do to preserve life, we should all be part of it. Our paper also stated that this fight is a whole state and a whole society, a whole government approach. And when we talk of a whole society where the church is a major stakeholder, we have to play our part. If you saw us with the president as we visited him, we're all wearing our masks. We didn't say that we are men and women of God and so we don't fear COVID. That was not what we said. We all wore our nose and face mask to show leadership, to tell our members that this is the way we have to go. And it is a way to prevent. It is a way to give us life. Christ came that we may have life and have it more abundantly. So whatever we will do to save our lives, that is what we have to do.
Doc, I'll come back to you again with what your expectations are of the Religious Affairs Minister on the very detailed plan that the churches are supposed to follow in implementing this. So I want you to think of that briefly. Let me come back to the studio and engage Sheik here. Sheik, you've had the perspective of the church.
Yep.
How will this pan out in the mosques?
I had suggested earlier on, and I want to put it here again, we intend to encourage the formation of COVID-19 prevention committees at the mosque levels.
Okay.
And that could be at the national, regional, district, community, and neighborhood mosques, where these things, in most of the neighborhood mosques, the limit set can apply because the number may not reach 100,
okay,
because it is within a neighborhood. So then the protocols is what we need to uphold. For example, you want to see the entrance point, what sanitizers has to pick, or Veronica bucket set over there. I'm even thinking that we should even now begin to use the temperature gun to ensure that the temperatures are, determined before one enters. We are also thinking about, my slogan is one man, one prayer rag.
Okay.
One man, one prayer rag or prayer mat.
Hasn't that always been the case?
No.
People share mats?
Optional, but we have a permanently laid mats in the mosque all the time.
Right.
But there are those who can afford, and so they come with their own certain designed kind of prayer mats which they spread. But this time it should be mandatory that everyone comes with his own personal mat.
Okay.
I'm thinking about our ablution bay. Instead of using water cans, we are asking that everybody, one, perform ablution at home, or you come with your own personal water can, which you use for your ablution, or we use taps which also must be repeatedly be disinfected at any time one uses it. Then we really have to do that. We are likely to face problems with the major mosques. Okay. And that's where we talk about the difficulty with the partial lifting.
Give us some of the major mosques you are referring to, and what problems.
If you take Accra, I mean, we have certain mosques, we call them a regional central mosque, or central mosque within the regions. For example, if you go to Tamale, the main Zamio Mosque, for example, is the major mosque, which attracts huge congregations. If you go to Kumasi, for example, the regional mosque, for example, we call it the regional mosque. In the whole that's the central. If you come to Accra here, where the chief imam worships, for example, Abosokai, is the central, and it's a whole community surrounding it, so it attracts huge congregation. And because our form of prayer is time bound and is fixed, it doesn't change. Then you have a difficulty even saying that you're going to have session by session prayer because the time is fixed, and that sort of thing. And secondly, our culture and tradition of worship is different. So. For example, if Chief Imam comes to Abosokai, you might have it's Herculean, to say, okay, only 100 people are entering, all of you now turn away and go back, or you are waiting. I mean, so I had mentioned that earlier on for caution.
Yeah.
But I'm happy that the details will have to be designed by the Minister of Religious Affairs. What it means is that I expect the minister to invite inputs as to how we can effectively do this. Other than that, implementation at our level could create some difficulties, and that's why we said, for us, government should do a proper assessment of the risk. If it's proper to lift it completely, then let's lift it, and then we now observe the protocols. But the partial one can create some difficulties,
especially for the Muslim community. Yeah, I see the problem you're raising here. So your time. So if you have to go to the mosque at say 5 a.m., everybody has to go because the prayer is for 5 a.m.
Exactly.
Isn't there a way to readjust this so that the people can pray, do the prayer, even if it's 5, and you can do it at 6 or 7? Isn't that possible?
Well, if within the broad rules of our jurisprudence, some of those flexibilities are there, but it depends so much on the time lapse, between one prayer and the other.
It's 1 hour not enough?
Yeah, it can be 1 hour. It can sometimes can be even be 2 hours. But you are also praying within. We have the preferred time, and then we have a deferred time.
Okay.
Now, so if you go outside of even the deferred time, so therefore it means that you are not praying within the time fixed. Okay. And the Quran says that prayer has been made obligatory for you to be said and performed at fixed times. That's what the Quran says.
Okay.
So, and the fixed time here is within a certain range. Okay. Going outside, it means that, in fact, for those who understand our jurisprudence, one of the conditions for the validity of prayer is to say it within its time. So it's a rule that you need to respect, and that's why for such decisions to be made, sometimes it requires a certain kind of input and understanding our tradition and culture of worship, so that we are able to cooperate very well.
Okay.
And then also, you are dealing with a larger tract of society whose mind has been oriented towards these things. So that's why I'm saying that sometimes it can be Herculean getting people to understand this. But I hope that when the minister sees it necessary to invite, so that we can make inputs. As I entered from far away from Sunyani, the secretary to the regional chief imam there was quickly asking me now, what are they going to do?
What's the plan?
So I told him, I'm just at the studio. From here, I'll rush, and then we begin to see exactly what are the things we need to do.
And given the fact that there isn't enough time on your hands at the moment, the announcement has been made. So people perhaps already start thinking of Friday. It's just on Friday. So people are perhaps looking forward to trooping to the mosque at the moment. So it looks like there's a time issue. In the unlikely event that you're unable to meet with the minister, what will happen on Friday?
In fact, like I mentioned earlier, my quick proposal, which probably if my brothers and sisters far away listen, is to quickly put together the COVID-19 implementation committee.
Okay.
Quickly put it together and begin to take certain initiatives, i.e., for example, how to control the huge crowd. You see, now there's a certain desire.
Yes.
Because of the long break. There's a certain desire.
Yeah.
Now we can go back to our mosque. Yeah.
So everybody is in a hurry to get there.
So when they throng like this, and on Fridays, in fact, we don't have, strictly speaking, we don't have membership of mosques.
So anybody can go.
Just like we have a church where if you take the Pentecost and you have, in fact, membership are known. In our case, as a Muslim, we flow, and wherever I move now and there's a mosque and it's time for me to pray, I enter and pray. And that's how fluid ours is. So even when it comes to matters of registration, you ask yourself, you read somebody's name, the next time he's not coming here. He's traveled he came from Sunyani, it was time for him to pray, he came and prayed and he went away.
But at least we'll have the contact details so that if there's any follow-up to be made, we'll be able to follow up from there.
We're able to take those contact details. So those And like the Reverend mentioned, even the timing, you know, because you have a fixed time when you're going to say your prayer.
Yeah.
Now you have a certain time you want to also say, everybody who comes in, you want to write his name. And it's not just write the name, but even his location, where he's come, his age or something, because you want to be sure he falls within the range of
So that will take
ages.
another time.
I mean, it will take a time. So it's a whole kind of something.
Interesting.
But we hope that we play our part.
Interesting. Dr. Silvakin, I'll come to you, but I want to bring in Reverend Boafo. Rev, the Muslim community is actually proposing for themselves the formation of a COVID-19 implementation committee. Is that something that will work for churches? And are you looking at that?
Thank you. Yes, it could work for us, so that they could be going around to be checking on some of these protocols and how we are all following. And then even give us some feedback as to how best we can move to phase 2. The churches can look at these other lines as well. So it's something that it's worth considering.
Okay.
And as you mentioned, it is also to meet with the minister and get the details, because the president mentioned that the minister will meet us and give us the details. So we need to listen to him. Then we can make our inputs, and then we can all follow.
One would have thought that the proposal that you sent earlier to the presidency would have included a bit of these, because the restrictions have been eased effective for the Muslim community Friday, and for the Christian community Sunday. So there isn't a lot of time. Aren't there points of references in the ones that you sent earlier that we can work with at the moment? And if there are, can you give us highlights?
Well, thank you. For what the president mentioned, we had all in our document, except the registration. The registration is what we didn't have in our document, and it's a new thing that is coming. But even before then, at one of our meetings, it was mentioned, because we're also listening and reading from outside the Ghana and what others are doing. And we saw that in one of the European countries, that was what they were doing, to register all those who come to church so that they could do the contact tracing should anything happen. And so it's a new thing that is coming on board, which we want to hear from the minister, how maybe they have put all these things in place. If there is nothing like that, then we'll put our heads together and see how best it can be done. Because writing 100 names with all the contacts and all that, as Sheik mentioned, it's also going to take another time. So how are you going to even restrict yourself and within that 1 hour to finish for them to go for another group to come and all those things? If we are going to wait for 15 minutes to disinfect or 30 minutes to disinfect, all these things should be taken into account, so that when we are apportioning the times fortunately for us, let me put it this, we don't have fixed times and say that, Sunday church service should be within this time frame. No, we don't have that. So we can come in at any time and say that the services are from 6 a.m. to 6 p.m. And within these time frames, people can come in and have that is the multiple services that we'll be having.
Interesting. Dr. Silvakin, I'm coming to you. You've heard what the religious groups are saying. In fact, for the Muslim community, they are saying that they would have preferred a complete lifting of the ban on social gathering, because of the time factors that they have, because of the nature of the fellowship, etc. From the biologist perspective, what do you see?
So I think our brothers and sisters in the Muslim community, they have a unique situation. And I'm happy Sheik was very candid. I mean, looking at the difficulties even regarding the ease of some restrictions, it will really be difficult. And honestly, since we are at stage 1, I don't expect the president to go back and say that for this peculiar situation, or because of this peculiar situation, all of you can go together and fellowship or worship. So it will be very, very difficult, nearly impossible for our Muslim brothers to congregate and worship, looking at the fact that for them, they have fixed times, they have fixed prayers. For example, you can just walk into any mosque and say your prayers. I mean, obviously, your details will be taken for any potential follow-ups to be done. I don't know whether before this announcement, they were doing any remote participation in terms of worship, for example. So maybe they can decide that for vulnerable populations, so for those who are maybe more than 60 years, they may be advised to worship from home if that is possible. I think we may ourselves, by ourselves, both Christians and Muslims, Buddhists, Hindus, we may have to also come up with some very unique means for us to adapt to enable us fellowship with our brothers and sisters. It will be very, very difficult, but I'm already foreseeing a lot of difficulties, especially with our Muslim brothers and sisters. For example, the fact that they have fixed times and they have fixed prayers, and the fact that you can even also walk into any mosque and pray. And I'm happy Sheikh also indicated that they plan forming some COVID-19
implementation committee.
Yes, implementation committee. I think this is a laudable idea. I think that I always advocate for local ownership, because if community members themselves set up such committees, they will be very vigilant. They will make sure that they themselves are adhering to the rules, responsibilities, and regulations regarding the formation of such groups, i.e. what they are supposed to do, what they are not supposed to do. And he also mentioned the use of single racks, prayer racks. Yes. I think this is also very good. And even if we want to extend it to our Christian brothers and sisters, things such as hymnals, things such as prayer books, I think it's about time we may want to do a lot of projections. I'm sure most of them have TVs or screens in their places of worship, so we can be using these projectors. We can even decide to do a lot of photocopies. And when it comes to, I'm sure in our churches we use mics, maybe we may want to adapt one man, one mic, for example, or we may want to ensure that these microphones are disinfected right after use. It is going to be very interesting. It is going to be very exciting. And I'm really also looking forward to a model church, a model church, or a model mosque, where such places will serve as examples. And I think these are things we may gradually want to be doing. I'm looking forward to a church becoming a model church for almost every single Christian church or fellowship to look up to, as well as a model mosque where people will themselves come up with some mitigation measures, of course, following on the advice or what the president has outlined, and hopefully what the Minister for Religious Affairs would also outline. But I'm sure there are a lot of interesting days ahead of us.
Certainly. We'll come back. But so I'm starting with you, Sheik. Now, people are very excited. They want to go out. So you mentioned that there is a possibility of overcrowdedness, example. How do you know that I am part of the first 100 to get to a particular mosque? Or are you going to make an announcement, like you do from the mosque when you're calling for prayer? How will people know?
I mean, that is the difficulty. Actually, we foresaw during the meeting with the Council of State, and we said, for us, we are likely to hit the trouble whenever it is made partial because of these things. Sometimes you enter as an imam, you are in front. and everybody who's in the mosque is also engaged. And so if somebody enters from behind, you might not be able even to know, except when you have somebody who, for enforcement reasons, you position the person, and whether the person has what it takes even to stop people from entering to come and engage. So I think for us to practice this in the kind of engagement and negotiation with the community is very, very important. Because it has to do with what people are used to, their mindset, their orientation. Religion is something that's so sensitive, and in fact, it becomes part and parcel of one's spirit, and the sensitivity that is associated with it is such that you are unable to really get people to shift immediately. So I think we have a duty, both at our level and at the level of government and ministry, to really engage communities, to really find space in people's mind to accommodate these things. Other than that, the difficulty will always be there. When somebody is coming, you tell him out, and then he's not happy. Because he doesn't even appreciate the just very well. And
also the possibility that people will then start also massing up outside, even outside there.
In fact, that is, you see, and that is the danger, because now they are coming in their big numbers. You create a traffic because you block it, and they say, okay, they are not going away. They want to, even let's assume the second session will come, they want to wait.
So they wait.
And
another crowd. Okay. And perhaps you all might also want to encourage praying at home, like he said.
Let me quickly chip in this. I was having discussion with some few, for example, the age limit. For example, if you take some people of my age, we still look strong, though I mean we above 60 years. So myself, I'm an imam. So how do you restrain me from going to the mosque? So we were saying that 65, they can't be discouraged, but not prevented. But 70 and above may be prevented. And to do so, you need to really make them understand that it is for their own good. It is not there just to kick them out from the worship, but that for their own good, their safety, and so on and so forth. That's why. And do a very good, audit our safety arrangements.
All right. Audits on safety arrangement. Professor Alfred Yosin is joining us. He is head of the Department of Community Health at University of Ghana Medical School. Prof, thank you very much for your time. First of all, what's your assessment as a public health expert of this easing of restrictions?
Good morning, and thank you very much. Happy to be here with you and to all your listeners. Yes, as we've said, we are anticipating very interesting days ahead, because we were also expecting a tempered release of the restrictions, yes. However, we can foresee huge challenges in the circumstance and the way we are going, and especially just given 1 week for all this to happen, especially for the churches and the mosques. How much preparations have gone in there, and as we are saying, our critical fear is the crowding, and that is where the challenge is. 100 people come in, how to manage it is really a test case that is going to be for us. And how do we manage it, especially when for close to 2 months, we've been struggling as a nation to even insist on people wearing face masks. That is our fear, and that is our challenge in the days ahead, because it's something that we should all be mindful of. If the cases are rising and rising gradually, the system can contain it. But if we create the scenario where there will be mass infections and the numbers exponentially increase, then it becomes challenging. We are hoping we won't get there, and we are expecting that stakeholders, in this case, community leaders, church leaders, we will demand full accountability and responsibility from these persons, as well as the state organizations whose responsibility it is to enforce this. It is always going to be uncomfortable for some groups and for some people, but we need to do so that we protect each other, and we are there for all of us. Otherwise, we are going to have challenges going forward.
But Prof, you paint a very gloomy picture, but that's the reality. The reality is, as a public health expert, you are concerned. I have the leaders here with me. I mean, some of the leaders here with me, the Christian Council. I have the spokesperson for the Chief Imam as well here. From a public health perspective, what advice can you give them in terms of implementing this ease of restrictions, if you like, at least having 100 people? What can they do to minimize to the barest minimum any potential of infection, should there be?
Yes, I think both Most Reverend and Sheik have illustrated some of the actions they want to take. And critical among this will be the engagement of their congregants. Community engagement will be key for people to understand that we are doing this for all of us. Yeah. And that some people may not have the opportunity, as being suggested, to come to the mosque or to the church. But that is not like preventing you from worshiping. Yeah. But it is to protect you and protect others. So I think the most important will be the engagement of this, not trying to enforce strictly, because as Sheikh said, religious matters go to the very core and the heart of people's behavior. And people may tend to be violent, may tend to resist, and then create scenes that you wouldn't want to. So I think the engagement and probably setting up committees, small committees here and there to engage these people. The leaders alone cannot do that. And then soliciting the support of the media and persons in positions to also continue to engage the members of churches, members of mosques. It is the way we can go along it, because strictly enforcing and using brutal force will not work in this case. You need to appeal to people's conscience for people to understand that, yes, your health is your personal responsibility. However, you have responsibility to protect others as well. And when people understand this with the leaders that they trust so much, we believe we can make a headway in this regard. So the engagement will be key in this.
Okay. I'm going to wrap up with final comments from each of you. But before I do that, Prof. Yosin, I also still want to engage you on this briefly. Are there any expectations of the ability? Okay, let me put it this way: our health system. So far, we have been told that our health system has been able to function properly because we are not waiting till people are critically ill before we go, because we are doing testing. But do you think that our health system at the moment will be able to suck in any mass infection, as you indicated? And how can we deal with that whilst we prepare to open up? How can we deal with the expectation that there could be a level of mass infection?
The health system, we will say, currently is coping. We won't say we are very comfortable. Health workers who are involved, who are in the front line, are stretched. But as per our training, we cope under whatever circumstances. But there is a limit to how much people can cope and how much the system can cope for how long they can. We should also be mindful that we shouldn't concentrate only on the numbers of deaths resulting from COVID. If we do that, we are being unfair and unjust to ourselves. We need really to look at whether non-COVID related deaths are not increasing. Because if we concentrate and people with diabetes, people with hypertension who would otherwise have had optimum care come to the hospital, and because of COVID, we neglect them or we are unable to give them the optimum care, these people may end up dying. And these are all Ghanaians. Any death is death. It's not only COVID death that we should be worried about. That is why we are always insisting that we should slow things down and we shouldn't create the opportunity for the numbers to escalate. Our health system, unfortunately, will not be able to cope in this circumstance. We are doing very well, trying to increase the number of testing centers, trying to get more isolation centers. But when it comes to the area of critical care, we are still really not there yet, especially in the regions and in the district. And we cannot, the center cannot hold for how long will the centers in Accra, Kumasi, and the big cities able to hold if we are not able to strengthen the other regional areas. So going forward, I think we should be strict and take proactive measures in strengthening the peripheral systems, regional hospitals, to be able to take care of critically ill persons.
All right. Let me take final comments. I'll start with you, Dr. Silverkin. You've heard everything. We've had this conversation. In fact, we started with you. What's your takeaway? What should people take away from this conversation from your virologist perspective? Okay, looks like you're muted.
Yes.
Okay, I hear you now.
Before I answer your question, so in addition to what Professor said, I think it's important we really plan very well, we prepare, and we also respond. So we know that already almost every single region has recorded a case or some cases, with the exception of Ahafo. But I think we may want to look into the health-seeking behavior of our people, because we don't even know whether people are hiding in their rooms, especially because in Ghana we've realized that 91% of those who tested positive are actually asymptomatic. And we know that there's the DIMS, the District Health Information Management System. So there's this database. We may want to be looking into it to ensure that in terms of pneumonia, high respiratory related infections, people are actually not reporting to our hospitals. I think we always need to be keeping checks and balances on these things, i.e. the health-seeking behavior of people, as well as our health information system. Like Professor said, we don't want our health systems to be overwhelmed, but I think that already our health systems should go into the active mode, because we don't know what will happen today, we don't know what will happen tomorrow.
Right.
In terms of the discussion we've had, I think we should all be very, very careful. So the president indicated that if you think, for example, your church is not ready to open up, I think it becomes very important that you still adhere to the remote participation, because if your church is such that you have a lot of so-called vulnerable congregants, then I think as a leader, you should definitely advise your people that, look, this is for your own good. And even if you want to still go ahead and open up your churches, I think you should lead by example, because as a leader, you should learn how to wear the nose mask very well and how to remove the nose mask as well. Okay. If we want to register our congregants and somebody sits in front of you, will the person, for example, remove the nose mask and speak to you? Or I think a lot of things we may have to put in place to ensure that at least we are limiting the spread of the virus. Remember that we may not be able to halt the transmission of this virus, but we can only through some simple mitigation measures limit its spread, so that at least our R0 will go below 1.
Thank you very much, Dr. Silverkin there. And let me take your final words as well. Well, let me come to the studio and take your final words, Sheik, as well. What should people take away from this conversation?
As quickly as possible, I think the initiative to form the COVID implementation committee about 4 churches and mosques for me is something. Secondly, if the minister is listening to us, this is a time not to waste time to quickly engage. To a larger community, I mean, COVID-19 is still a reality. It's a phenomenon living with us. Let's continue to maintain the protocols.
Thank you very much, Sheik. And also, I'll take your final thoughts, Reverend Dr. Boafo. What should people take away?
Thank you very much. It's been good talking to you and listening to my colleagues. It's giving a lot of insight from the scientist's perspective and from my brother Sheik's perspective. I think, one, we all need to prepare. The preparation from now to Friday or to Sunday should be very intensive, in the sense that if we are not ready for even the coming Sunday, we should say that no, we'll wait until the following Sunday, which will go a long way for all of us. And we should also know that as churches and mosques, we play a major role we are major stakeholders. We can help in making these restrictions work. If we are easing it, how do we come in as major stakeholders to make sure that the country does not go beyond the things we are seeing outside? It's life here. It's life which is at stake, and we should all be concerned in making sure that our people are alive. So churches, my colleagues, I'll plead with all of us to exercise restraint even from now and not rush. We should sit and think through it. We will be ready to meet the minister and make sure that whatever plans are put in place, we will go by them and make sure that the people of Ghana live for all of us. That's what I would want to say.
Doc, thank you so much. And Prof. Yossin, you join us later. So I wanted to give you the final word, but I believe that you've spoken a lot already. If you do have any final words, you can add up to it as to what people should take away.
Yes, I think we will be grateful as a nation to our leaders, our church leaders, and the leaders of the mosques in this regard. We will plead with them, as we say, responsibility and accountability. The nation will be key. And if we feel we are not ready, we should tread cautiously and open up as and when we are, and show by example, as we have discussed, as leaders, so that we encourage our congregants to abide by the rules. Not in a harsh manner, as I say. People will rebel when you do that, but we need to continue to appeal to people's emotions and let them know why they need to do what we are asking them.
Prof. Yossin, thank you so much. I've been doing this conversation with 4 great people. Dr. Augustina Silverkin, she's a virologist with KCCR. Professor Alfred Yossin is head of Department of Community Health, University of Ghana Medical School. And Most Reverend Dr. Paul Kwabena Boafo is chairman of the Christian Council of Ghana. I had here in studio with me Sheik Shaibu, spokesperson for the National Chief Imam. It's been a great conversation. Thank you so much for joining in. Most of you have sent messages. We'll read them as and when we get the chance during the show. But we wish to apologize to our cherished audiences in the UK for their inability to access us through the TuneIn app as usual. Remember, though, we are available on myjoyonline.com and abdomonline.com. You can also access our streams on Facebook, Android devices, Google Play Store, and Apple App Store as at myjoyonline.com and Adum Online. Also, I need to let you know this. The National Service Scheme has started processing prospective National Service personnel for deployment to various sectors across the country. MMDAs, ministries, departments and agencies, education institutions, hospitals, security agencies and private corporate organizations. Those interested in hosting service personnel in the 2020-2021 service year should put in a formal request to the National Service Secretariat. User agencies should log on to the NSS website to submit their request for these personnel. Also, you need to attach names, email addresses, and contact numbers of 2 officials for this request. Agencies with special needs should contact the headquarters of the Secretariat for discussions. And remember, all requests must reach the NSS head office by 30th of this month. And for further enquiries, you should visit www.nss.gov.gh. National Service, service to the nation. I'm going to take a very quick break. Roland Walker will be back with a conversation on how you will be paying more for fuel. We'll be right back. This is the AM Show.